My name is Tony Bates and I am the CEO and founder of Headstrong. And I suppose I worked my life in an adult psychiatric hospital for 25 years, and you know, the thing that strikes you is that most of what people need and get in terms of mental health is too little too late. And when they're young and they're sent to a kind of a psychiatric hospital, it's too much too soon. So I figured, you know, we need to catch people upstream when problems develop, which is around 15, 16, 17, 18. And there's nothing in the country that really does that very well. It's a kind of a dead zone. But it's also where the system is. The system is weak, but it's where the need is greatest. This is when it all happens. So we thought about, well, how do you do it? Do you set up, do you open clinics? Do you open little specialist little centres? And we thought, no, that what's really important is to and somehow involve a whole community around young people, with young people at the centre of the conversation, and build something that is owned by the community and that young people feel works for them. And that's Jigsaw. So it's a community-wide systemic system of care, but also with a direct access free main street, a hub where people can walk in and get help. And there's a whole menu of supports available. I think the intended outcome is that every young person in Ireland would have someone to turn to and someone to talk to in their community, that they could access easily for free. And that remains our intended outcome. Also, I think the intended outcome is that communities would have a different way of thinking about young people and about mental health. So part of what we were doing is to change the conversation about mental health from a very over-medicalised one to one that was much more human and much more existential and much more about, you know. So that's what we're continuing to do. How do we do it? I would say that from the starting point to when we kicked off was almost 3 years. I would say it was a very intensive process of beginning to investigate the terrain we were in, beginning to see what was out there, focus groups all over the country, working with professionals, designing a model that would make sense to people and people would buy into, conducting some preliminary research on needs and resources in individual communities. All of that took time. And I would say the most important thing in implementation is that you begin by listening, that you appreciate that the environment you're working in is far more important than whatever you think you're doing, than the product you're trying to disseminate. You know, you might have a great idea, but that's not as important as the environment within which you're working, the people you're working with, because that's a very flux, changeable environment, and unless you have them with you, your intervention, no matter how brilliant it is, won't work. So I'd say listening, and then not assuming that people want what you have to offer, but actually building the case slowly with people, bringing them with you. So by the time you unveil it, they say, oh my God, that's exactly what we need. And that takes time. Our initiative involved multiple agencies, you know, the health system, the education system, the local authority system, families, young people, educators. All of those were going to and do play a part in Jigsaw. So we had to bring those on board. So there was a lot of, so we conducted a needs and resource analysis, which meant we had an intensive 3 weeks in a particular community. Let's just narrow it down. We have 10 communities, but let's take one, like Galway was our first. So we spent a lot of time interviewing young people in focus groups, families, doctors, psychiatrists, psychologists, youth workers, teachers, nightclub owners, you know. And we did all of this, and we did a needs and resource analysis in terms, we looked at all of the available resources in Galway. We geo-mapped them on maps. We looked at the distribution of young people, where they were, what age group they were across the county. And then we got about 120 people together and said at the end of maybe a 3-4 month program, this is your community. This is your life, you know, this is what you've got. And people began to see where young people were, like in Athenry, there was cluster of young people and virtually no services at all. And there was, in Galway City, loads of services and an older age group of young people, you know. And then again, in presenting all that feedback and those charts, people began to see their community in a different way. And then we began to say, okay, what do we need to do? So the next step is to develop a working plan. And that would have taken about 9 months. And that working plan had to be quite comprehensive from it need to involve all the stakeholders, it needs to develop pathways to care, good clinical governance, all of those things, training, supervision, all needed to be in place. And at the end of that time, we unveiled that, and costed and funded and funded in a way that could make it sustainable for at least 3 to 5 years, because we knew it needed that time to get off the ground, and we couldn't achieve our goal in a shorter time. So we just, you know, so that was important. So we then had our map. So then we launched, and launching involved finding premises, involving young people in that, and then picking a premises and then designing it so it's very clearly Jigsaw. And you've got that in Galway, you've got it in Donegal, Offaly, Kerry, Meath, and in South Dublin. So we then, and those premises, the selection of those was very important. They had to be, young people were involved in that selection, because we had to know that they would feel comfortable. And we picked places sometimes they didn't like. So we learned a lot. So again, always looking at the end user. What is going to work for them, not what works for us. And then the branding, the design, the planning was very much done with young people and by young people. And all of that takes time. But when we opened, it was a big hurrah, and a lot of local sports heroes came and opened, and Galway has grown from, it was then 5-6 people to about 20 people, Jigsaw Galway now. And it's very well established, and it has moved premises and really become part of the DNA of the county. I think any innovation is challenging for people, because sometimes something new comes in, something that was there changes, and people, there are always losers in every change initiative, people who lose. Psychiatry in our case was a big loss, because suddenly they had been in charge of the whole system and now we were coming in. So that's a very delicate thing. Always look to who's losing out by you being in town. What we were doing in Jigsaw was new, and therefore people, no matter what their training was, they had really to learn about a new way of interacting with young people. So training was very important and continues to be very important. We have hub training for the staff, everybody, including the receptionist. We have training for the clinicians in how to work with people in a very short term and so on. We have training nationally for clinicians coming together in a Jigsaw Learning Network. 4 times a year they get together for 2 days, and they have kind of more intensive training, continuing training. We have supervision. In all the sites are supervised by a senior clinical coordinator, and then nationally those are supervised by a director of clinical governance. So there's a great deal of supervision. We have KPIs to check, you know, what are we doing with people? You know, the KPIs can be how young people are welcomed, how they're followed up, how we make sure that this is working for them. And we have very detailed data management systems that track are young people getting what they need? Why do they come and how do they benefit? And we follow up after 6 weeks and 6 months. So we're building. It's not enough to just do something great. You've got to be able to tell the story, and data help you to do that, and data track the impact of training, and we watch those carefully. And then that data is available to the staff, and they can look at it and say, you know what, we're not seeing as many young boys as we used to. Wonder what's changed. And then they might realize something, you know. So data is not just to monitor and audit, but it's also to give feedback in real time to people at their weekly meetings, so they can make adjustments as they go. I think one of the things we've excelled in is our data management system. We have data in real time on 10,000 young people that we've seen up to yesterday. It was 10,052. And we tracked all of those, and there's about 30 data sets for every for all of those young people. So we know why they're coming, where they're coming from, what they go through, what happens, and what the outcome is. What we've learned when we've analysed the problems they present with is that, you know, for the most part, they present with anxiety and stress, with very somatic symptoms. They feel all bundled up inside. They're frustrated, irritated. And then the second most common problem is they're acting out. They're cutting, they're drinking, they're behaving, engaging in reckless behavior. And so I guess one of the simple things we've learned, and it's profound but simple, is that, you know, distress that's within us but without words gets acted out and gets expressed in symptoms. But that when people can begin to talk about these things, the acting out eases and people find a different way of carrying the difficulties they have or engaging with them. And in our outcome, the data, we see that there's an extraordinary, I mean, I would say about 80% get but what they wanted and more, not just what they wanted, but they get, you know, we agree very concrete goals with people as to what will be the outcome of this particular intervention or engagement with Jigsaw, and we track to what extent that's happened for them, and all of that data is available too, and it's very encouraging. It's very important not just to evaluate the outcome of the program, which is critical. Is it working? It's very important to track the drivers of change. What is it that achieves implementation? We know that, you know, one of the drivers of change is engaging with young people. We know another driver is leadership. We know another driver of change is creating alliances within the local community between services. We know another driver of change is training. So in all our sites, we have these as like KPIs. These are, and we set them with the site every year, and we track to what extent these are being achieved. So you've got to keep an eye on, if you like, the engine that's achieving the outcome as well as the outcome. I would say that after 8 years of heavy lifting, of having made a great deal of mistakes, and an expert is someone who knows what doesn't work, and you achieve that knowledge and that wisdom the hard way. But it's very, very important, and never underestimate what you learn from things that don't work. None of these decisions were recklessly taken. They were good decisions, but they didn't work. They were the wrong thing. And after all of that, we've kind of learned a little about what does work. And now the program has been recognized by the HSE as a national program, and it's now part of their national plan to consolidate the 10 jigsaws and to grow them. So we're now currently involved in 3 new counties where we're having discussions. I was in Leinster House yesterday, but they want us to begin in another county indeed. So we're involved in new counties where we're beginning to start that process. We figure from the first conversation to when we open the door is probably about 3 years. And that sounds a long time, but actually it takes that length of time. And that's the one thing I'm sure about. It takes longer because you're bedding something in and you're deepening the roots. You're not just going public and having a big opening and have nothing really to support the service. We're dealing with mental health of young people. You've got to be damn sure when they walk through the door that you've got something to offer that's safe and robust and that really responds to their need. I would say being involved in implementation of this program has required me to grow up, to become much more aware of what's happening in the real world, to deal with a lot of setbacks, disappointments, knocks. People don't always welcome good ideas. They often react to them, and because they're threatened and worried about change. And I think the thing is, you need people around you that can really support and keep alive that vision. You need a shared understanding and dream that you know what you're doing together and you don't lose sight of that, because ultimately, you know, it does work, and when it works for young people, it's fantastic. But it's easy to be disheartened on the way, and the thing is, you need each other not to give up, so you don't give up. Hang in there.